First of all, though, there would seem overnight to be some degree of confusion about this morning following the Prime Minister's latest statement. We're hearing kind of mixed reactions to Boris Johnson's Sunday night announcement. Union leaders have condemned the decision to actively encourage people in England who cannot work at home to return to their workplace, while business groups have broadly welcomed the moves to get more people back to work. People still have lots of questions, though, over things like some children returning to school, perhaps, quarantining after travel, safe social distancing at work, travelling to work, a reopening of shops and services, and so on and so forth. Well, let's catch up before we delve into some of those through this programme with Dr. Duncan Robertson from Loughborough University School of Business and Economics. Duncan, it's another Monday. Boy, the week's whiz past.
They certainly do.
Okay, so on the announcement from the Prime Minister last night, one of the sort of infographics that came up was this whole business about the R number. Just explain that to us, really.
Well, I think, although it's not very clear, that the government wants this, as we've been discussing for quite a time, this R level, the reproduction number of the virus, to go down. And, I think the sense is that if R is less than 1, this virus will phase out. And that's true over many, many weeks. And I think that's the target that they're trying to look at. And yes, we have this number. We're not sure where it is. We're told somewhere between 0.5 and 1. And I think what the government is trying to do is to release some of these lockdown stringencies that we have in order to maintain that R less than 1. But I think the important thing to know is that if R is below 1, it doesn't mean that people aren't going to go into a hospital and aren't going to, subsequently die. It just means that rate is controllable. And I think that's the very difficult thing that the government's trying to do, is to, as you mentioned, try and balance the economy with people's lives. And that's a very difficult and, ultimately a political decision that's being made.
Now, that R level, if you like, so as we know, the aim is to try to get it beneath 1. And I think what we were told last night was it's somewhere between 0.5 and 0.9. 0.5 would seem to be as comfortable as you might want it to be. 0.9 seems very close to 1. How do we know which end of that scale it is?
Well, I think the answer to that is if we have testing, then we can make an estimate of the testing of that level R. Now, I think the important thing to talk about is this R level. Initially it started off at 3, and that was called the R0, and that's basically what happens if you let it loose in a population and don't have any control measures. Now we've got it less than 1. Essentially. Sorry, I've forgotten your question. Sorry about that.
No. It was just about the figures seem quite broad, 0.5 to 0.9. I mean, in the great scheme of things, you think, well, that's just a fraction of something. But actually, in the terms of an epidemic, it's quite important how far from 1 we are.
Exactly. So, if we're at 0.999, then it just goes on at the same rate, carries on. But if we're at 0.5, then it will reduce. But, I think there's a bit of confusion, certainly in the government slides, when they talk about a rate of infection, but it's actually a reproduction number, and it just means how many people you infect if you have the virus on average. And that on average is very important, because that may be the reproduction number in the country, but in individual care homes and in individual hospitals, it may be significantly different to that, and it may be over 1. So, you have these epidemics within and outbreaks within care homes and within hospitals. If you can control those, then you can start thinking about releasing the lockdown measures. But, we're looking at this as a country as a whole, but we're not looking at these individual hotspots where the R could be over 1.
Now, look, just on a broader thing, there was lots of content, of course, in that statement last night about, this morning seems to be some discussion about who you can meet outside, whether you can meet your parents or just one, or what. Do you have any clarity on that?
Absolutely none. I mean, the thing is that that what you normally find is when these sort of statements are made, there is a big note that goes along with it, and that's, we're told, coming. But in terms of what's actually changed, the legislation hasn't changed. We can still breaking the same laws if we don't go out without reasonable excuse. So it's very unclear, and there was a plan, but it was all very conditional. So I think we're waiting for it to go for more information to be released today and for it to be discussed in Parliament, and then we'll actually know what the changes are. So a lot of it was conditional, and really not a lot changed. It was more in the sort of messaging, the famous thing about stay at home going to stay alert, and the sort of colour going from red to green. These are quite subtle changes that are going on, but essentially the legislation hasn't changed, and that's why it's still quite confusing. But hopefully that will be picked up in Parliament, later today.
I read something very briefly at the weekend. Maybe you can shed some light on this. That there has been a certain degree of concern within some NHS circles that the messaging has been so good that people have been staying away from using the NHS, even if they really should be using it.
I think that's right. If you listen to the chief medical officer, I think he was very clear that people aren't using the NHS, so because they may be fearful of that. And I think what's happening is that they're having infection control measures in hospitals and GPs, so that your risk of infection is relatively low. And there's always this trade-off between, what are the direct COVID-19 deaths and what are the indirect COVID-19 deaths. And, if we don't call when we're having chest pains and these sort of things, then potentially there are some other lives that are being lost that way. So I think, as we do release these lockdowns, it's very important that people sort of go and have access to the health facilities that are available so that there are no indirect effects.
And there was a sort of reference in passing last night as well to the fact that obviously this is a novel disease, and our knowledge of it, much like the disease if left to do what it wants to, our knowledge of it is rising exponentially. What sort of research is going on at the moment?
Well, there are people looking at exactly how it's transmitted. For example, if people are infected, does that immunity last for a long time or for a little time? And there, a lot of research is being done about, how it's transferring in the community, and if you can actually start mitigating these measures. But it's, the sort of scientific advice is coming out quite late, and it's quite difficult to see what's going on in real time. But, all researchers around the world are all wanting to understand more. And, hopefully that knowledge and research gets through to the policymakers and they make policy decisions on that basis.
Duncan, as ever, thank you so much for coming on and shedding some light on some of the murkier areas of the science behind all of this. Thanks ever so much for coming on, and we'll speak again next week.
Perfect. Thanks, Ben.
Thanks, Duncan.